Hello everyone, welcome to tonight's webinar. My name is Sarah Keane and I am the CPD manager here in Duggan Veterinary Supplies. I'm delighted to welcome both Grace Mulcahy and Dr. Craig Mincher today for tonight's webinar. Grace is joining us from University College Dublin, where she is a full professor in veterinary microbiology and was the Dean of Veterinary Medicine in the UCD Veterinary School for a number of years. She has an active research group focusing on helminth immunobiology, vaccines for veterinary parasites, and One Health. Craig Mincher is a qualified vet with a BSc in agriculture. He has worked in the UK for a number of years before starting a veterinary pharmaceutical company in South Africa. He is now the clinical and veterinary director of Telenostic. Duggan Veterinary Supplies is based in our purpose-built facility here in Thurles in County Tipperary and includes a conference room, our clinical skills lab, of which you can see here behind me. We are delighted to be able to offer educational courses to the veterinary profession with a focus on interactive and practical learning. Our CPD range has grown in its first 3 years, with us now offering on average 2 to 3 courses a week for both private and general veterinary population groups. Our courses are delivered by our highly qualified and experienced key veterinary specialists and cover a wide range of topics. We hope if you haven't already attended a course with us, you will do so in the near future. We are also educational partners with Improve International, which offer postgraduate and nursing certificates to Irish vets and nurses. An example of this is the certificate in small animal surgery, the practical elements which are held here in Thurles, County Tipperary. We are also proud supporters of Vet Support Ireland, which provides support services for veterinary professionals across Ireland and the UK. This is just a look at our CPD website, cpd.dugganvet.ie. This allows learners to log on, create a profile, add courses, join our free webinars, and it also stores your certificates of attendance for further need if you would require them down the line. And it's a handy little tool and a very user-friendly platform. Tonight's webinar, I'm delighted to say, has been awarded 7 CPD points by AMTRA. I will require everyone who requires AMTRA accreditation just to submit their names and AMTRA numbers to the email you see here, cpd@dugganvet.ie, in order to gain your points. And it is pending approval from the VCI for 1 CVE point for our Irish vets and nurses. This is just some sales information. Should you have any questions on any of the things that are discussed tonight, this is our Irish sales number and email, and also our UK address. And please feel free even to submit any questions or queries you have in the chat function, and we'd be delighted to get your representative to get in touch with you after. But for now, I am going to stop sharing and I'm going to pass it over to Craig.
Okay, thank you, Sarah. Let me just share my screen. Okay, can you see that?
Yeah.
Thank you very much and good evening to everybody. On behalf of Telenostic, I'd just like to thank Duggan Vet very much for organizing this and setting this up. I think we've been told that they're just short of 300 people that have registered for this webinar, which is really fantastic. And some of you may have been on the one when we launched Oversight, which was in about September last year. I think growth has been exponential and extremely good, and uptake very, very good. So hopefully quite a few of you that are already using Oversight are on the webinar as well. The reason for this webinar partly is because we've just launched the Fluke offering on Oversight. I'm going to take about 12 minutes of your time. I'm just going to run through the principles and the differences between the Fluke and the standard FEC and the sample prep. Bearing in mind that there are a number of new people on here, I just want to run through the technology for those of you who don't know it yet. The oversight is an automated parasite ID for fecal egg counts. And it basically starts with, prior to we'll start with the preparation of the sample, and I'll run through that shortly. But once the sample is prepared, the
Sorry, Craig. Sorry, we're just looking at the presenter view there for the slide.
Okay, sorry,
Yeah.
let me
You're okay.
swap it around.
Just in case people. Yeah, that's it.
Okay, thank you. So start with the prepared sample, and the sample is basically injected into the cassette. The cassette is placed onto the analyzer, and the analyzer then has a high definition camera on it, and it also has a microscope lens, which is a 10 times objective, and that scans the cassette and takes about 187 images around the whole circumference of the cassette. Those are then uploaded to the cloud services platform, and we've developed artificial intelligence models that then recognize certain objects and identify and cross-reference them back to the library for that particular species, labels each of those objects, and in this case, what you can see there are strong owl eggs, and that is then fed back down to the instrument, which will then give you the result in real time. And we also have a web interface, which has all the images that have been taken. So it's a very open and transparent system. And the results you get are for each species that pertain to that particular host species, and will give you a count of each of the eggs. If we look at the standard FEC test, and this is what's been on the market for the last year, we use a sodium chloride flotation fluid, and it's all blue coded like this. And we cover equine, bovine, and ovine. Equine, the 4 important species, strong owls, Parascarus, Strongyloides, and Anapocephalus species. And then in bovine and ovine, the strong owls, which are probably the most important to you, together with Coccidia, the Nematodirus monesia, and we recently launched on the algorithms the Strongyloides species. Now with the launch of Fluke, everything is color-coded, and I'll explain to you why we've done that as well. And we cover both Fasciola hepatica and Paraphosomum species in both bovine and ovine. And whereas before we had a single filter, and we have a double filter for Fluke, and I'm just going to explain to you the principles of why we've gone that route. We use the same analyzer, so for those of you that do have the oversight analyzer, nothing else is going to change. I'll run into a little bit of detail, but when you do order the test kit, you will get a starter pack that'll have the filters and everything else that you need in it. The 2 species we're looking at are liver fluke and rumen fluke. And I just put this slide here really for those of you that will look at some of the images that you get. You'll see that the images, once they're in flotation fluid and we use zinc sulfate, the eggs actually collapse a little bit, so they don't always look exactly as the textbook shows you. And these are 2 of the images here, if I can just highlight those as well. There's a liver fluke, and there's a Paraphosomum egg, and they look sort of collapsed and slightly different, but rest be assured the algorithms and the AI has been trained to recognize them as that as well. So the sample prep, and just to run through very quickly, it's a 3-minute sample prep. For those of you who've been using the standard FEC, the blue one is just under 2 minutes. There's an extra step, and I'll explain that to you. And then there's a flotation. So once you've done your sample prep and you've put it into the cassette, it actually has a shorter flotation time of 3 minutes, and then a scan time of a full 15 minutes. And then the report is generated. That scan time may well come down in future, but at the moment we want to run the full scan, which is the extended scan and not the standard scan as you may have been using before. If we go to principles of flotation and what you'd be using on the standard FEC for nematodes, cestodes, and coccidia, it's basically the principle of the egg being smaller than the mesh size. The egg, the purpose of the mesh is really to retain the debris, so you get fairly clear filtrate so you can identify the eggs. So the eggs pass through the filter and the debris is retained, and that filtrate is then withdrawn into the syringe, put into the cassette. And if you're using a McMaster slide, the same principle would have applied as well, that you take the filtrate and you put it into some sort of mechanism for those eggs to then float to the surface, where you can then identify them through a microscope, or in our case, through the oversight analyzer. The specific gravity of sodium chloride is 1.2. The majority of eggs are fairly light and buoyant, nematode, cestos, and coccidia, and they will float to the surface, and it's basically that the density of the eggs is less than that of the surrounding fluid, so the surrounding fluid pushes the eggs to the surface, and then you can identify them. With Fluke, it's slightly different. So the Fluke eggs are larger and they are much heavier. And we use a two-filter system. The first sort of step one, and they are named like this as well to make it easier for you. But the sort of first process is a coarse filter. It's the same principle as what we've been doing before. So the egg will fit through the mesh and it will go through filter one. Fasciola eggs are roughly 140 to 70 microns, and we're using 180 micron mesh. So for all intents and purposes, it's a coarse mesh. The debris stays behind and the eggs flow through. Underneath that is a second filter, which is a fine filter, which is the apertures in the filter are much smaller than the eggs. So the eggs get trapped on the surface of this filter over here. And the water passes through. So what you're left with is a really thin layer of eggs on the surface of this filter. The next step then is basically to take that filter tube and to turn it upside down. We turn it upside down, and it is marked with filter 3, and I'll show you a very quick video on how that looks. It is very simple, and we are now sitting with the eggs on the undersurface of this mesh. And the previous steps all involved water, so it's really just trapping the eggs between the two filters. This third step now basically involves the zinc sulfate, which is our flotation fluid. So we really wash the eggs off the undersurface there. They collect in the beaker over here. They're withdrawn out of the beaker with a syringe and put into the cassette. And as you can see here, the specific gravity we're using zinc sulfate is 1.42. So those heavier eggs will then float to the surface. The traditional method and the most commonly used method, and has been shown to be one of the most accurate methods as well, is sedimentation when you're dealing with Fluke eggs. Because you're not using a flotation fluid and you let them sediment to the bottom, we are basically trapping the eggs, and then we're using flotation to get them to the surface to observe them. So it's really a process of filtration and egg capture and then flotation. And why am I telling you this? Because it's really important, if you do have our system, that you use the correct filters and the correct flotation fluid for the correct species. And everything is labeled in orange. It's sort of a coral color that is basically Fluke, so everything matches the filters and the flotation fluid. Whereas if you're doing standard FECs, they're all blue. The filter is blue and the flotation fluid is blue. I'll show you a quick video. It's been speeded up, obviously, but just on the sample prep, as I said, it's less than 3 minutes. But here you're basically just mixing in water. You're pushing it through the filter 1 that's getting captured on filter 2. So you're just really washing everything through to retain the debris, turning it upside down, and then you just flush it through from the surface over there, and then withdraw it and put it into the cassette. So it really is pretty straightforward, but the principles are important. That's using the correct flotation fluid with the correct, for the correct species of egg you're looking at. We do find often, and just the cameras and everything are calibrated to deal with the flotation fluids that we do provide you. And sometimes if alternative flotation fluids are used, it will change the results, potentially change the results. In terms of confidence that you can have in the results, we looked at a number of lab methods to use as benchmarks in our development and validation. And it was surprising to us how many labs had different methods of looking for Fluke. It's traditionally, even in the labs, it's a time-consuming, difficult process. That's why many clinics don't do it themselves as well. The sedimentation requires a 30-minute sedimentation time for the eggs to sink to the bottom. I think sedimentation is probably the most common sort of gold standard that's used. And I think UCD uses the sedimentation method as well. And this doesn't involve flotation fluid, but involves the eggs sedimenting to the bottom, removing the surface fluid, and then examining them in a Petri dish or a larger surface area. The other method that we looked at, and we looked at a number of European labs as well, was a number of processes of centrifugation and flotation. Also very time-consuming, about a 20-25-minute sample prep method. We looked at a number of methods over there, and some of them, they varied very much in their sensitivity and the number of eggs that we recovered, and we settled on one from one particular lab, and we compared ourselves against those. And we were looking at two things. One was the sensitivity for liver fluke. So liver fluke, traditionally, you don't get a lot of eggs coming out in the feces, so you really want to be able to pick up those, even if it's 1 or 2 eggs, be able to find those eggs and identify them. And we found that our sensitivity was very comparable to both the sedimentation technique and this flotation or centrifugation technique. Very, very close in terms of sensitivity. In terms of rumen fluke, we're really looking at recovery there, and I think Grace will go into this in more detail. With rumen fluke, you get a lot more eggs in your sample as well, and counts are probably going to become more important in rumen fluke, whereas the actual fecal egg count in liver fluke isn't as important as whether it's a positive or negative. And in rumen fluke, we looked at the recovery of eggs that we were getting with the 3 different techniques, and Oversight did better than one of the techniques and equivalent to the others. So we're very comfortable in terms of recovery in rumen fluke that our results are on par. In summary, you'll be using the same analyzer. You'll be getting a new starter pack. The new starter pack will have the filters and a sample of the flotation fluid, similar to what you would have had for the standard FEC. There'll be a separate Fluke test kit, and that test kit is cassettes and flotation fluid. So when you purchase a Fluke test, you'll get the cassettes and the flotation fluid, which match each other. In summary, the sample prep, 3 minutes. It's a filtration and egg collection. And it's the same platform technology that's done so well for us over the last year. So it's just the addition of the AI algorithms specifically for Fluke, and some slightly different lighting on the instrument. And then it's obviously the sample prep as I ran through with you. What to expect when you run your first samples. There'll be a tandem review by the clinical team when you run your first samples. For those people that take it on in the next sort of month or so. And the reason for that is whenever we launch a new product as well, because of the variability of samples that we get from very many different geographical areas, our clinical team will analyze and visually give a confirmation on all of those scans that are coming in. And so you'll get the results probably within an hour during the day. And once we're comfortable with that, then it will be released as per the standard FEC, where the AI runs completely on its own. But this is just part of our sort of extra quality control in the beginning that we always run alongside with the AI as well. Thank you very much. So I'll hand over to Grace now as well. And thank you very much for your time, and happy to take any questions at the end of the webinar. Thank you.
Okay. Hello, everyone. Lovely to be here, and lovely to see so many people coming out of a Wednesday evening joining us to talk about parasites via this webinar. So thanks very much to Duggan Veterinary for inviting me to come and speak on this interesting topic of liver fluke and rumen fluke. And thanks to Craig for a very interesting exposition, really, of how AI is changing the face of parasite diagnostics, as it is indeed in many other facets of our life today also. But my brief today is to talk about liver fluke and rumen fluke. And really what I hope to emphasize is that, in fact, we have not a static situation in relation to these two economically important parasites, but a situation which is changing. And we really don't understand fully why that is. So I hope to keep you on your toes and keep your interest in talking about some of the things we're beginning to find out about these two parasites. So the picture here, as you'll recognize, is just some of these rumen flukes here within the papillae of the rumen, and this is where the adults are found. So they're not typical trematodes, they're round and fleshy, unlike our friend, the liver fluke. So what I'm going to do is start talking out about liver fluke, and again, apologies because a lot of the information will be basic, but I'm not going to go into a huge amount of detail. I'm going to go on then and talk a little bit about rumen fluke. In between the two, I'll talk about the diagnostics and the control of these two parasites. And I'm going to finish off then in talking about how these two parasites and their epidemiology more specifically may be changing, and how they interact between each other, how this throws up maybe some diagnostic conundrums for us to solve, and what the future may hold in terms of controlling these two parasites in the light of the changes that we're seeing in the epidemiology of infection with liver fluke and rumen fluke. So again here, this is our Trematodes 101. As you will know, both liver fluke and rumen fluke are flatworms. They're flukes or trematodes. And this illustrates here a typical trematode life cycle in that we have the juveniles and adults in the definitive host. In this case, in our situation, we're talking mostly about ruminants, sheep and cattle. The definitive host produce eggs. Here's a typical liver fluke egg here with a little operculum through which the miracidium or the first larval stage emerges. This first larval stage is motile. It can swim around in a film of water until it reaches an intermediate host. And the intermediate host in the case of both liver fluke and rumen fluke are snails, mud snails, as you'll see. We then have several other larval stages developing within the intermediate snail hosts, culminating in the release of this other larval stage, the cercaria. And what the cercaria does is it loses its tail, curls up into a ball, secretes a protective wall of cement around itself, and lies in wait then for an obliging definitive ruminant host to come along and eat it up, and the whole thing happens over again. More specifically, when we're talking about Fasciola hepatica, the same general principles apply. A couple of extra details here. The intermediate host of Fasciola hepatica in almost all cases in the climate that we live in is the mud snail Galba truncatula. It used to be called Limna truncatula. And this snail, of course, lives on the borderline between the water and the dry land, hence the propensity for these low-lying damp areas. And the miracidium enters the snail. The cercaria come out the other end after a period of growth and division, and the herbage then is contaminated by these infective metacercaria. So I always make a joke with the vet students that this isn't to scale, to get them to remember that the Galba snail is not a big snail that you might see in your garden. It's a tiny, tiny little thing, you know, just very, very hard to spot, a couple of millimeters in length. So they're very, very small. And as you all know, this is the kind of land which is very dangerous from the point of view of liver fluke infection in ruminants. So we talk about both macro habitats and micro habitats suitable for the snails. And it's the presence of these snails that really determine the epidemiology and the presence of liver fluke on land. So if you were to go hunting for these snails here on this land, which I took a picture of this land out the window of a train a few years ago in the west of Ireland, you will find snails along the border of this poach mark here. You will also find it along the border of this bigger pool of water here. And this is not land that, unless you were a very brave and indeed foolhardy farmer, you would graze sheep on, because the likelihood is that these sheep would develop a very heavy infection with liver fluke and you would have mortalities. So that's typical land that we're dealing with when we come to deal with liver fluke. And of course, this is exactly the land where we find our friend Galba truncatula, and you could see its diminutive stature here in comparison with the grass blade, where it secretes and where you find the encysted metacercaria. So this again on the right-hand side is a grass blade magnified to show the diameter of the metacercaria in comparison with the width of the grass blade. If you've got a very good, very sharp vision, you might be able to see these as little white dots on the grass blades. And here's one a little bit magnified to show the protective cyst wall around it. And inside, developing here essentially is a little tiny baby fluke, a juvenile fluke. Now, when we work with these metacercaria in the lab, we can get them to hatch by essentially stimulating them or exposing them to the conditions they would find in the small intestine of the intermediate host. And indeed, we can buy these because you can perpetuate the life cycle of the fluke in vitro. And so what you see here in this little video is you see the dark brown shells are the metacercaria which have yet to exist. There are some which have a brighter, a kind of an empty look to them, and they are the ones which have already hatched. in response to the presence of bile salts, digestive enzymes, and about 39 degrees centigrade. And moving around here, you can see the little flukes that have just come out of the cysts. So we call these newly excisted juvenile flukes, and they are essentially little tiny flukes, exactly the same structures and organs inside of them as the big flukes, which we're more used to looking at. And they're quite active. And of course, these are the creatures that start off the infection in the definitive host by moving all the way across the mucosa of the small intestine, right the way through, and make their way across the peritoneum, then along the lining of the peritoneum, penetrate the liver capsule, spend several weeks moving around the liver capsule, causing destruction of tissue until they eventually grow up and mature and reach the bile ducts. So it's quite a remarkable journey, and one that's very interesting to study. If we're not lucky, of course, what we can end up with is a situation like this. And this is the liver from a sheep which died from acute liver fluke infection. As you can see, there is widespread pathology here in the liver. The surface of the liver is a very abnormal color. It's much paler than it should be. You can see hemorrhages on the surface, both petechial and larger hemorrhages. And you can see also deposition of fibrin strands, which is an indication that there is an acute inflammatory process going on. And of course, we know that if sheep are exposed to a heavy infection suddenly, you can get extreme cases like this where the liver tissue is really destroyed. That doesn't happen to the same extent or indeed at all in cattle, because cattle have a liver which is a little bit more fibrous, and they seem to be able to restrict the rate at which the flukes pass through the liver. But what is very common is this picture here, which is that of a bovine liver in the chronic stage of liver fluke infection. So again, this is a very common sight in an abattoir. So if you slice through a liver, the first thing you see is these bile ducts, which are much thicker than normal. They are hyperplastic. And again, if you slice through them, out comes these liver flukes, which are still motile and will move with this undulating motion in the response to the shock of being now not in their nice, warm, protected environment. You can see here one which has been cut off or cut in half by the knife. And these are the adults which inhabit the bile duct of the liver, the bovine. And although cattle do not die typically from liver fluke infection, there are well documented and serious production losses, which we can document in terms of growth, milk production, and also increased susceptibility to other infectious diseases. So in Ireland and indeed in Great Britain, we understand the epidemiology of liver fluke quite well now. We know the risk factors, and these are largely the risk factors or the factors which favor the growth and development and reproduction of the snail intermediate host. So apologies to our colleagues joining us from GB at the moment, but I've only got a map here of Ireland, but the same factors apply. So in Ireland, we have a lot more rainfall in the west coast in the western part of Ireland than we have in the rest of the country. And the more rainfall we have, basically, the more chance we're going to have liver fluke infection due to the presence of the snails. And this is especially true when we have mean day-night temperatures of above about 10 degrees centigrade. So in the summertime, if it's nice and moist and also reasonably warm, the snail population are breeding very rapidly. We can have about 3 generations of snails per year. And this leads to heavy contamination of pasture in the summertime, which will then lead on to clinical disease in animals later on in autumn and into the winter. So again, a rapid run through in the epidemiology. Typically, liver fluke infection, fasciolosis, is a winter disease of livestock, so very different from PGE, for example. We can get acute signs of disease in sheep from August onwards, sometimes even a little bit earlier, and then subacute and chronic cases in sheep from autumn and winter. And then chronic liver fluke infection, more or less, we see in cattle at any time, but we tend to be most aware of it and to pay most attention to dosing of cattle for fluke at housing time, and that's a convenient time to dose animals. We know, and again, as a result of, I suppose, climate instability, the epidemiology of liver fluke infection, like indeed many other parasitic infections, is becoming less predictable. And over a couple of decades or so, we were seeing an increase in prevalence of liver fluke infection. Now, that may no longer be the case, as I think I'll show you when we talk about rumen fluke in a moment. And we also know that wildlife reservoirs can complicate the control and the epidemiology. So this is the European brown hare here, and this is one of the most prolific and accepting wildlife hosts of liver fluke. So hares can also contaminate pasture and serve as a reservoir of infection for livestock. How do we control liver fluke? Well, unfortunately, we haven't really changed the way in which we control liver fluke very much, really, since we came to have effective drugs like triclobendazole. Most important thing is to avoid trouble spots. The old adage of fencing off fluky areas still holds, and taking care, particularly where we graze sheep. And we have really nice and sophisticated forecasting methods now. So originally, Olorenshaw in GB was the first person to develop an effective forecasting method. And now that has been refined with more sophisticated methods, with inputs from data from meteorological inputs and from vets and from other sources. So we do have very good forecasting methods. And then when we take into account of those prevention methods, we also sometimes have to use strategic dosing, more of which anon. And strategic dosing means not just dosing if you think, oh, you know, it might be time to give a dose, but really using your knowledge of the epidemiology to inform your control strategy. Okay, and if you're using your knowledge of epidemiology, you should also be taking into account what your diagnostic tests tell you before you reach for the dosing bottle or the drenching gun. And there are, of course, a standard number of types of diagnostic tests available for diagnosis of parasitic diseases, and more specifically Helminth diseases in animals. So many of them, of course, rely on fecal examination. And Craig has already introduced the concepts of flotation and sedimentation. And it's sedimentation that is very routinely used for diagnosing liver fluke infection of animals. But as Craig has described, we can also use flotation, and indeed sometimes we use a combination of flotation and centrifugation. But basically it's fecal examination. And this will directly detect the fluke eggs. We can also use tests now which detect not fluke eggs, but antigens which are secreted by the liver fluke. So we have available on the market now a coproantigen test, which detects, again, these molecules which predict the presence of adult flukes in the animal, and indeed sometimes immature flukes as well. This is a very useful test. And in fact, in some cases, it can detect the presence of fluke infection before fecal examination within the pre-patent period. A bit of a disadvantage of it is that you need to have very fresh samples. The test does not work quite so well if the samples haven't been tested, within days or sometimes hours, or if they've been frozen. So that's a limitation. And in individual animals, of course, we get biochemical and hematological changes as a result of liver fluke infection. So we get elevation of serum liver enzymes, GLDH, and later on GST. And this can be a really useful adjunct to diagnosis. And we can get anemia developing as a result of liver fluke infection and eosinophilia. So while not absolutely specific, the liver enzymes certainly are very good indicators of liver fluke infection. Bronchoalveolar lavage isn't applicable to liver fluke, quite obviously, but we do have bulk milk antibody tests available, and that dairy farmers now are beginning to use to really see what the level of antibodies to liver fluke is. And that can be very useful as part of a herd health program to see how the levels are varying from one part of the year to another, how they compare this year with last year, and should be really part of a herd health program in terms of controlling liver fluke infection. So generally, when we're talking about fecal examination as a parasite control tool and as a diagnostic, there are a few different ways in which we can use it. We can use it as a surveillance tool. or we can use it, for example, to test how well our antibiotics are working. It's best to consider our fecal egg counts for PGE, but also for liver fluke as a surveillance tool. And we know that if we just do one fecal egg count, it gives us a snapshot, a moment in time, what's happening then, but it doesn't really give us a continuous picture of change. And so it is better to consider how and when we might use fecal examination. And we can use fecal examination to talk about and to get information about the seasonality of disease, about local effects, about differences between different parts and farms, different pastures. And most importantly, we can use it now to determine how effective our treatments have been. And this is very useful when it comes to antibiotic resistance, and indeed resistance in terms of flucicides is a big problem. In lungworm, and Craig has, or sorry, in fluke, liver fluke, as Craig has already said, we're not so much concerned with the level of eggs, rather with are there eggs or are there no eggs, because any level of liver fluke really is of significance. And in cattle, sometimes the level of eggs are very low. We see low levels of eggs present, and it can be a little bit insensitive in that point of view. And as Craig said, also, the picture is slightly different when it comes to rumen fluke. So how do we use these liver fluke diagnostics? So we can use a test to treat protocol. Sometimes people say, okay, do I need to treat my sheep now, or can I wait a bit longer? Do I need to treat my cattle at housing? If I have treated them at housing, do I need to treat them again? The limitations of the diagnostics using fecal examination detection of liver fluke eggs, as you can see here, are the long prepatent period. First of all, we have to assume that animals can be infected as much as 3 months before we'll have eggs present in fecal samples. We commonly use this sedimentation technique, but at least in cattle, this is has quite a low sensitivity. So just because your cattle aren't showing eggs and feces doesn't mean that flukes aren't there. So it's best to take samples from more than one animal and at more than one time. This can be supplemented with liver enzyme levels. So consider using more than one diagnostic modality, and consider using, for example, coproantigen detection or antibody detection in milk. And sometimes people are using it in lambs now to see, okay, can I decide when, or can I discover when the lambs actually are first getting exposed to liver fluke infection by looking at antibodies in the blood. So a multiplicity of diagnostic tests there. Okay, so we've diagnosed liver fluke infection. What drugs available do we have to treat it? So this slide is a useful one produced by Chagusk. And as you can see, we have a limited number of flucicides because most of the drugs we use to treat PGE, for example, are not effective against liver fluke. And as you can see, we tend to classify these drugs as those effective against only the mature flukes. So albendazole, for example, will be one of those, and those effective against both the immatures and the mature flukes. And it's the immature flukes that are most difficult to target with drugs. And there's only one drug available which is effective against the so-called early immature flukes, which is something below about 6 weeks, whereas closantel is also effective against the immature flukes, so just before they start laying eggs, and then a wider range effective against mature flukes. So it's not a very pretty picture, and it's even less pretty if we consider how effective these drugs are as compared with how they used to be. So we have evidence in Ireland that there is a troubling and increasing scenario in respect of resistance to flukicides. So this was a study done back in 2009 by colleagues here in UCD, and they looked at a number of sheep flocks in the west of Ireland, and they treated some of them with trixlebendazole, some of them nitroxanil, some of them with closantel, and some of them oxyclosanide. And they did fecal egg counts before treatment, and again 7 days afterwards, which is a standard fecal egg count reduction test when it comes to flukicides. And here's what they found. And the take-home figure here is that while these 3 drugs here, nitroxanil, closantel, and oxyclosanide, still had a high level of efficacy against the flukes, our favorite and go-to drug when it comes to killing these immature flukes was only 51.8% effective, or at least we only got approximately a 50% reduction in the fecal egg count. So this is very worrying, because this is the only drug we have capable of killing these early and mature flukes and really preventing acute liver fluke mortalities in lambs and in sheep. So we're quite resistant. And they found this on 3 out of 5 sheep farms they tested in the west of Ireland. Okay, quick change of topic now, and on from liver fluke to rumen fluke. And don't worry, I will come back and talk about liver fluke and rumen fluke and how they interact in a few minutes. So the first thing to say is, okay, what do we know about what rumen fluke species are present here? So just to clarify the nomenclature, rumen fluke is the colloquial name for all of these different species of flukes that are found in the rumen, the forestomachs of ruminants. They're also called by their common name of paramphstomes. And for a long time, we thought that the commonest or the dominant rumen fluke or paramphstome species present here and in GB and in Northern Europe in general was Paramphstomum species like Paramphstomum leydeni or Paramphstomum hiberniae, hence the name Paramphstomum hiberniae. And it wasn't until 2013 that people began to look by molecular techniques to see, actually, was this the case? And Philip Skuse from Morden was the first person to identify the single species called Calicophron daubnii in livestock in Great Britain. And he went on, and others went on to find that this was the dominant species present in Great Britain. And very shortly afterwards, in 2015 and 16, we found exactly the same thing in Ireland. So we found in both sheep and in Ireland, this single species, Calicophron daubnii, was virtually the only species we found. So it's dominant everywhere. So our old conception that, you know, paramphstomes aren't dangerous, so we won't bother about them, and they're probably Paramphstomum hiberniae, was not the case. And in 99.9% of cases, we found now this single species. So we didn't know this species was here. So the question is, was it always here or was it introduced? And because we can't really go back in time, we don't know. It would be very interesting to maybe do some molecular analysis on specimens which have been stored back, you know, in the early part of the last century to see which species were these. Were these Calicophron? Was it always here? Was it introduced? And has there been a species change which has influenced the epidemiology of the interaction of these two parasites? But anyway, Calicophron is the only rumen fluke here in any great numbers in cattle and sheep in Ireland and in Great Britain. So here's the diagram covering the life cycle of the rumen fluke. This is produced by Animal Health Ireland a few years ago now, and it shows most of the information you need to know about it. So the adult rumen flukes lay the eggs. Like the liver fluke, the Metasicaria insist on pasture, and they develop within the snail. The flukes insist on the grass, and then you get them progressing into the GIT. There's no migration into the liver. The standard story is the juvenile flukes migrate down to the duodenum and then come back up to the rumen, but actually we're not quite sure that that's true. And I think you'll spot another something that isn't true again on this slide, in that it says, if you can read the very small writing, that we used to think that aquatic snails, Planorbis, were the main host of these rumen flukes, but we now know that no, it is in fact our friend Galba truncatula. So the main intermediate host of Calicophron daubnii, the species of rumen flukes we have in cattle and sheep in Ireland, is, hey presto, the same intermediate host that supports the liver fluke. So here may be a clue as to the changing epidemiology and the changing relationship between the two species. So same thing, mud snails also host Calicophron. Okay, so what about the pathogenicity of Calicophron, about rumen flukes in general? So again, for many years, we blithely told the veterinary students, you don't need to worry about these. Yeah, we see them, but they don't cause any disease. They're only really pathogenic in tropical countries where the juveniles can cause problems of diarrhea and so on in young calves. And we began to say, ooh, maybe that's not quite the case. Now, I should hesitate, and the health warning here is that most cases of rumen fluke infection in cattle and sheep are still, we believe, non-pathogenic. Many animals are infected without showing clinical signs. But we're not quite as sure now that in all cases, the flukes are as benign as all that. When we go and look at the textbooks, and particularly look at the literature on rumen fluke pathogenicity in other parts of the world, we see that the standard story, again, is that it is the juvenile flukes that you can see here in the mucosa of the duodenum that are pathogenic and that can cause hemorrhagic diarrhea, particularly in young animals, but that the adult stages in the rumen are very well tolerated and don't cause any disease. And the big question here in Ireland is, even if we don't see overt clinical disease in animals infected with rumen flukes, are there production losses? And I think, you know, we need a lot more research, and we need to really come up with more evidence and more data on that before we can assume yes or no one way or the other. And I think, again, the whole story about the juveniles migrate down to the duodenum and then come back up to the rumen, we think that there's a question about that. We don't quite know that that's the case. Another alternative explanation is that in animals which have a very heavy burden of infection, there's a kind of an overspill into the duodenum, and these juvenile flukes then don't grow because they're not in their natural position. But anyway, that's all for the future. Now, when it comes to Chalacophron daubnii, as compared with liver fluke, there are some similarities and some differences in how they behave in the environment and in the intermediate host. So on the top here, you see the eggs of liver fluke, fasciola, and on the bottom, you see the eggs of Chalacophron. And as you can see, they're very similar. So they're similar size and shape. They have an overlapping size and shape. They both have an operculum here through which the larval miracidium emerges. But the big difference, and the most reliable way to tell the difference between them, and I think Craig will say that the algorithm does this of the ovocyte machine, is that the liver fluke egg is a nice bright yellow color, whereas the Chalacophron egg is more transparent and is colorless. And in fact, you can kind of almost see into the Chalacophron egg. So they have these sort of transparent shells. And that's interesting because they have different hatching behavior. So the Chalacophron eggs develop optimally with 5 to 7 days of continued light exposure. And the Cercariae of Chalacophron, but not Fasciola hepatica, are positively phototropic. So they behave differently in relation to light, and that may affect the epidemiology as well. Okay, so what about the interaction of Fasciola and Chalacophron and the changing goalposts that I mentioned at the beginning? Well, basically, in a nutshell, what is happening is that Chalacophron has become much, much more common over the last decade, and in fact is much more common in cattle and also sheep than liver fluke is. So, big change there. And here's some data which came from the All Island Surveillance Report, which is produced annually now by the Department of Agriculture and Food and Marine in Ireland and AFBI in Northern Ireland. And these data are from 2020, but they produced data since which haven't really changed at all. And there's lots of really interesting data in this if you want to go digging in. It's all available online on parasites, but I have just highlighted here the two figures that I'm going to refer to. And the first is that in sheep, only 8% of the fecal samples submitted to the regional vet labs in Ireland were positive for Fasciola hepatica, but 22% of them were positive for Chalacophron daubnii, so much, much more higher prevalence of C. daubnii infection. And in AFBI, very similar. I think these figures are for cattle, but 6% of them were positive for Fasciola hepatica, and 50% of cattle samples. whopping huge percentage of cattle samples were positive for C. daubnii. And these weren't submitted, these weren't samples submitted just because they suspected liver fluke. They were just samples submitted for general parasitic diagnosis. So chalacophrin is everywhere. We're beginning to say now it's a ubiquitous parasite of ruminants in Ireland. So to supplement or in parallel with this data from the passive surveillance from the regional vet labs, we did some work and some data analysis on the samples which came into our own diagnostic labs here in UCD. And also we looked at data from in more detail from the regional vet labs. And this is this publication from 2018 in Parasites and Vectors. So this slide here is from that paper. And it shows and it analyzes the change in rumen fluke and liver fluke prevalence and interaction, which seems to be an ongoing trend. And the top slide here shows the situation in cattle, and the bottom slide is for sheep. So if you just look at the top slide, you see the most dramatic thing, and that is the dominance of chalacophrin daubnii infection in cattle, as is reflected indeed in the regional vet lab data. So almost 50% of cattle samples here. It varies slightly seasonally, as you can see, it goes up and down, but between 2010 and 2015, as many as 50% of cattle samples here were positive for chalacophrin eggs, whereas a much smaller percentage here, maximum 30% down to less than 10% in some cases were positive for liver fluke. And the red line then shows the samples or the number of samples which were co-infected with both liver fluke and rumen fluke. And in ovine, the trend isn't quite so dramatic for rumen fluke, but it still is much more common in sheep now than liver fluke is. So what we've seen is a progressive increase in C. daubnii infections, as well as the number of animals infected. The intensity of infection has also increased. And we're seeing, we think, a decrease in Fasciola hepatica infections, as you can see here in the line from cattle. So why is this the case? What is progressing, or what is causing this? Similar data here shown graphically just in this map here. So again, this is a heat map showing in red color the number of samples positive for rumen fluke as compared with the number or percentage of samples present in liver fluke in both cattle and sheep. And so quite an overwhelming prevalence of rumen fluke in cattle particularly. So we went on then, and I won't go into this because of pressure of time, but we produced a predictive map for rumen fluke infection. Like liver fluke, as you would expect, because of the shared intermediate host, the prevalence of infection is greatest in the west of Ireland, but we also see very high pockets of intensity of infection in the rest of Ireland as well, in these red dots here. So this is particularly around sheep. We found that the highest risk, of course, is in the west and northwest, and the risk factors are soil drainage, land cover, and habitat for C. daubnii. And we do also have a little bit of evidence, but this needs to be more robustly, I think, documented, that maybe Suffolk sheep are more susceptible than other breeds to rumen fluke infection. We know that there are slight differences in the risk factors for liver fluke and rumen fluke. So, for example, vegetation, and this may reflect to the light sensitivity of the metasicaria, is more important in rumen fluke. But by and large, there are overlapping risk factors for the two, which are interesting. And we know also that temperature is maybe less of a critical factor for rumen fluke than liver fluke. We know that if cattle are present on a farm, this increases the risk for sheep to be infected. And of course, treatments for Fasciola hepatica influence the relative prevalence. So here's one clue. So we know we treat sheep and cattle for liver fluke the whole time. We tend not to treat mostly for rumen fluke, which is appropriate. And so does that explain the difference? In my view, it doesn't, because, you know, treatment for liver fluke isn't a recent thing. We're not treating more for it than we used to. And in fact, triclobendazole is becoming less effective. So there probably are other factors at play explaining the changing epidemiology between liver fluke and rumen fluke. So in summary, what do we know about liver fluke, rumen fluke, and their interaction? We know now, and we can say for certainty, that cattle in Ireland at least are much less likely to be infected with liver fluke than with Chalicophron daubnii or rumen fluke. We know cattle are also more likely than sheep to be infected with C. daubnii. In fact, the odds ratio is about 3 to 1 for cattle versus sheep to be infected. However, in both cattle and sheep, being infected with one of these parasites makes it more likely that infection will also be present with the other parasite. We know that C. daubnii is more likely to be present in the winter time. So like liver fluke, it has a higher prevalence in the winter, again, because of the shared intermediate host. However, even in summertime, in the samples that we looked at, the prevalence rarely fell below 30% in cattle, even in summer. So it is reaching the stage of being an endemic, highly prevalent parasite. We know that co-infection between the two became more common between the 5 years that we looked at, 2010, 2015. We don't have evidence of competition in the final host in the ruminants between them. So in other words, you can get infected with liver fluke and rumen fluke. Certainly there's no indication that one protects against the other. However, the different story in the intermediate host, and now we're getting into something important. In the snails that we've looked at and that others have looked at, co-infection between these two parasites is actually very rare, indicating that there may be competition between the two, or that if a snail is infected with one parasite, then they just die off if they're infected with the other, or infection with one prevents infection with the other. Beef and dairy cattle, as far as we can see, are equally likely to be infected with Chalicophron, but dairy cattle seem to be more likely to be infected with fasciola. And again, we don't really understand why that is the case. So to finish off with, I'm just going to take you through very briefly a documented clinical case which was attributed to rumen fluke on a dairy farm. And again, the health warning is that infection with rumen fluke with Chalicophron is extremely common. Clinical disease is still very rare. So there was a bit of a panic, when people started hearing about this first, and people were rushing to treat with oxyclosinide, which is really the only drug that we have evidence of efficacy. But anyway, we do see occasional clinical outbreaks, but they're rare. So in 2016, this paper was written to document the outbreak on a dairy farm. And in summary, 31 spring-born calves were affected, 11 of which died, so acute mortalities, and 8 further mortalities in the following week. And on post-mortem, these calves had large numbers of C. daubnii in the duodenum, and they were immature C. daubnii. And again, James O'Shaughnessy, who works now in the Department of Agriculture and Food and Marine in Backweston here, did the laborious task of going and taking samples of Metasecariae from the pasture. And he recovered over 1,000 Metasecariae per kilogram of dry matter on the pasture. And this indicates that the calves on this pasture would have been exposed to in excess of 5,000 Metasecariae of C. daubnii per day. And the crucial thing is he didn't find any Fasciola hepatica at all on this pasture. All he found was Chalicophron. Similarly, when he looked at the snails from the pasture, he found that 30 of those 70 that he collected, almost half were infected with C. daubnii. Only one had Fasciola hepatica, and none of those snails were co-infected. So something very interesting happening there. Currently, we don't recommend any treatment for rumen fluke infection, but we do treat with oxyclosinide if we come across infection. So just to conclude then, this raises many more questions to which we don't yet have answers. Is there interaction between the two parasites in the intermediate host or in the final host? People are very interested now in the effect in rumen on methane production of the parasite. Is climate change responsible? Has there been a change in the interaction between these two parasites and the intermediate host? All to be decided against in the future. But it does raise the question of, can we use biological control to control liver fluke, which is still a much more significant pathogen? There are examples from other trematodes where biological control, pitting trematodes against trematode in the same intermediate host, can be used. So, you know, with all this time we've spent trying to develop vaccines against liver fluke, has Mother Nature had the answer all along? Can we revisit biological control, maybe to use rumen fluke or another parasite which infects Galba to control liver fluke in our animals? And is liver fluke as a problem going to decline if we get more rumen fluke? The jury is still out, but I think it's a very interesting biological question. And certainly I think will keep us all in our toes on the week to come. But in the meantime, really important to be able to diagnose both parasites, and oversight is certainly helping us to do that. Thanks very much, everyone. I'll stop now.
Thanks, Grace, and thank you, Craig, for that. So we have a lot of questions. I don't want to keep everyone here all night, but we have a lot of questions after coming in. So I'm just going to go through some of these. You'll excuse my poor pronunciation of some of these words. But the first one would be, would metastasia be visible on a fluke sediment test with McFadden stain or McFadden stain? Often seen circular structures like those on a slide. Don't know what a
I'm not sure I know what McFadden stain is either, but I don't know why you would be seeing metasaccharida in a fluke sediment test, because they wouldn't be in the fecal sample. So what would happen if an animal ingests the metasaccharida? They would hatch and the juvenile flukes would be released in the duodenum. So it's unlikely that you find the metasaccharida in fecal samples, but if you do, it's of no big concern anyway.
Oh yeah, sorry, it was actually a fluke sediment test.
Yeah, but a fluke sediment test is done on.
Sorry, yeah. Okay, understand. So the next one then is, how long do fluke antibodies remain high in milk in treated animals?
Depends on the test that you use. If you use an antigen, which is a broad spectrum antigen, you can get the antibodies remaining high for quite a while after treatment. If you use a recombinant antigen, such as one of the ones we've worked on against cathepsins, the antibodies decline actually quite quickly after an effective treatment. So it's a variable question, but it's best to test maybe several weeks after treatment, and you should see a decline, but they don't always go completely away. But they do vary after treatment. Yeah.
Okay. Craig, this one would be for you. How sensitive is the ovocyte?
Okay, when we're talking about sensitivity, we're speaking about liver fluke in particular, and we're talking about a negative or positive animal, whether that's a true positive or false positive or false negative. It's very, very similar to what Grace put up on the slide there as well in terms of laboratory tests in the 30% mark from a sensitivity point of view on an individual animal in cattle. I think Grace made the point, and it's very important that that multiple animals are tested at multiple times. Then you're going to pick up whether you find one animal or 10 animals that are positive. It doesn't really change your clinical approach. So you should be testing multiple animals. And I think it's an important point also to say you shouldn't be pooling samples. For fluke, you should be testing individual animals. If you're pooling samples, you're just diluting that even more, the chance of picking it up. And the reason why is partly because in liver fluke, the eggs are released by the bile ducts and intermittently. So sometimes an animal might be positive, but you're not picking up any eggs. And secondly, the eggs are normally in very low numbers. What we've seen in our trialing as well is that liver fluke, often you'll only find 1 or 2 eggs in a sample on an EPG, so you'll get a very low EPG, whereas with paraphostomum or rumen fluke, you're getting very high levels of eggs. So I hope that answers the question. But it's really, oversight would be doing what the laboratory would be doing, but bringing it in-house at the same sensitivities.
Okay, thank you. Another one here then. Do we now think that rumen fluke is causing clinical disease or a lack in feed efficiency?
So the answer to that is the jury is still out. We think that obviously, because the majority of animals will be infected in Ireland, clinical disease, overt clinical signs are not common. So it is the exception rather than the rule that we get clinical disease. But because of the very high numbers of parasites we see, and particularly in some of these cattle we've looked at, the whole rumen is really just chock-a-block. We don't know for sure whether there are production difficulties. I think that work still has to be done accurately. Interestingly, there has been work done to show that rumen fluke, or the presence of rumen fluke, actually can decrease methane production from the rumen. So that might be an interesting and unexpected side effect, which could be beneficial. But all of these questions, need to be researched and to be looked at much more effectively. We're only really beginning our journey to understand the life cycle, the pathogenicity of liver fluke. But what we can say for certainty is that clinical disease is not the norm. So you don't need to panic. We do not recommend dosing in the absence of clinical signs which can be attributed to rumen fluke, and where liver fluke is not the cause of those signs.
Okay, thank you. Craig, another one for you. What does the result report look like from the oversight?
Okay, so we're giving an EPG at the moment. We did start off with, just by the way, we have run this in a pilot study with a number of clinics in Ireland already before we've launched. And the feedback from them is they were asking generally for an EPG as well, albeit, and I'd like Grace's input in this as well, in that when you're talking about liver fluke, it's really a positive or negative. So if you're getting even a very low EPG, you're going to treat it as a positive. When it comes to, obviously, to rumen fluke, it's an EPG, and they're much higher EPGs. But Grace, this might also help people that are signed on. If you, just for example, have 5 or 7 calves that you're testing individually, and you're getting an average EPG for rumen fluke of 500 EPG, and you're getting 2,500 EPG and a 3,500 EPG, are you going to approach those any differently from a rumen fluke point of view?
No, you're not, because even with those very high egg counts, we still don't recommend treatment unless there are clinical signs. So we can have very high rumen fluke egg counts without clinical signs. And remember, in animals where we do see clinical signs, it's often the flukes that aren't yet or aren't producing eggs that are the cause of the trouble. So again, we often have, a lot of adult flukes present, but sometimes juvenile flukes present as well. We have to understand the dynamic between those. But in our current today, and it may be different next year when, we've more research, or the year afterwards, but we don't recommend treatment at whatever egg count unless there are clinical signs present, which can't be attributed to another cause.
And I guess what's important to also just put in there as well is that it may be PGE, or it might be, you should be running probably as a standard fecal as well.
Very much so, very much so.
Particularly in young animals.
Absolutely. And it's human nature to want to go and want to say, oh, this is this unusual parasite coming now. Whereas very often it's the boring old PGE, liver fluke, nutrition, whatever. All of those kinds of things can cause similar kinds of changes and diseases that might otherwise be attributed to rumen fluke. So do not assume that it's rumen fluke unless you've ruled out everything else. And in some cases, indeed, we have post-mortem evidence to substantiate that. It is still unusual. That may change, but we don't think most animals are exhibiting clinical signs.
And then just another question from me, which ties into this, which will help people as well, particularly for liver fluke. What is your sort of window and the timing of year that your fecal egg or your fecal test is going to be most successful? And when is it going to be? Obviously during the pre-patent period, which is going to be probably sort of early winter. You're not going to pick them up, or late autumn. But just from your point of view, when is your fecal going to be most successful, and when must you rely on other tests? So
in sheep, you will be seeing eggs definitely during the winter time. So again, though, because you want to avoid acute disease in sheep and mortalities at a time when they won't yet be shedding eggs, you would maybe want to be sort of maybe using some additional diagnostic like antibody tests in lambs, or using the clinical history. So your fecal egg counts are just one of the diagnostic criteria you're going to use. In cattle, we would commonly take fecal egg counts just before housing, because that's the time when you're going to dose. So, you know, we generally tend to assume now, certainly in areas like the west of Ireland, that animals are going to have fluke. And then we will routinely dose them at housing. Maybe that's not necessary anymore since we have this changing scenario. So the best time to take a fecal egg sample strategically would be just before you decide what dose, if any, you're going to give around about housing in cattle. And remember then, if we're dosing cattle at housing, depending on the drug we're using, we may need to give a second dose a few weeks later to take care of any immature flukes which won't have been killed if we're using, for example, albendazole or something like that. So yeah, roundabout housing, I would suggest. Again, don't forget about the importance of diagnostics to detect how well your treatment is performing. And again, using fecal egg count reduction test now for fluke is a very well established protocol. And we started off by using it for strong gulls, and we have good protocols now for detecting resistance in fluke. So certainly if you've been using, for example, triclobendazole for ages and you've no idea whether it's working or not, I would suggest doing a fecal egg count reduction test autumn time, winter time, to see is your treatment working. That would be a really good thing to do. And if you're not seeing a reduction in your egg count of 90%, and if you're seeing levels at like 50%, as we showed in the paper there, then you're in real trouble. And unfortunately, we don't yet have another drug as good as triclobendazole to take care of those immature flukes.
Thank you. Thanks for that. We've another few. I don't know will we get them all covered, but we'll try and get through as many as we can. What dosage of oxyclosinide do you recommend for rumen fluke control?
So oxyclosinide, to my knowledge, doesn't yet have a licensed claim for rumen fluke. However, it is known to be effective against it. And this is off the top of my head, so subject to correction, but I believe it's 10 milligrams per kilogram for cattle and 15 milligrams per kilogram for sheep.
Okay, super. Thank you very much. The next one then. Is the prevalence of rumen fluke and liver fluke likely a reflection of treatment choices in different stock and possibly a lower use of oxyclosinide across all species, and so not cleared out medically as much as by management and epidemiology? Yeah, I mean, it is certainly one of the parameters, one of the variables that we're taking into consideration, you know, is the way in which we treat for liver fluke, maybe in cattle and sheep, is that altering the relationship between the two of them. But my personal view is that it's not the only factor, because again, we've had all of these anti-fluke drugs for a long time, and it's not until comparatively recently that we've seen this dramatic increase in prevalence of rumen fluke. So it may be part of the reason, but I personally don't think it's the only reason, but that's just my gut feeling. And we don't have the data to really know what's happening, but we urgently need to get it. Okay. For Craig then, how many of each test can be conducted in a veterinary clinic for both the FEC and the fluke in 1 hour?
Okay, depends whether we're running them, obviously using the same machine for each test, and they're separate tests. The FEC, we can get through about 6 to 8 samples in an hour, and it's different with the FEC because we're able to float. We have a 7-minute flotation period, and you can do that off the instrument, then put it on the instrument and skip the flotation. And the test, the full scan test takes 15 minutes, but we have the standard scan, which is the equivalent sensitivity of the McMaster, which you can finish after 5 minutes. So where you have very high counts or very low counts that aren't within sort of 100 EPG of what your threshold is, you're able to do do the standard scan. So you can get through quite a lot that way. In terms of fluke, the flotation is 3 minutes, and we don't have a longer flotation because the longer we leave it, we find you get a lot more crenation of the eggs, but you also get a lot of flotation of debris as well, some of that smaller debris that's gone through. And we're doing the full scan at the moment of 15 minutes for the scan, so you're looking at about 20 minutes for the fluke. For liver fluke in the future, What we may have is when you do get a positive that you're able to stop the scan. That's not functional at the moment, particularly for this launch period. And again, because we're talking about a binary positive or negative. So if you pick up a liver fluke in the first 10 images, there's no need to continue. That will be something that will come in later. So those times will come down, but for now, it's as I've said. So you probably get through, if you're just doing liver fluke, 3 scans in an hour and 6 to 8 on the standard FEC.
Okay, great. How are samples homogenized for ovocyte, gut worms in particular? We've identified homogenization as a significant weak point for our McMaster technique, particularly if a large sample is brought in. How much water, if any, is added to aid homogenization before adding salt solution?
Okay, so currently our recommendations follow the same recommendations as you would for any other, whether it's McMaster or anything else, but our recommendations are generally on dry mixing. We are going to bring out some recommendations on wet mixing as well. Wet mixing is important because then the process you follow will have to change because you would have already added some salt solution, and you need those amounts of feces and what you're adding to correlate to get the correct egg count. So we'll bring out some new recommendations on that because we're aware, particularly in sheep, it's a lot more difficult mixing the harder pellets.
Okay.
But currently it's dry mixing and really breaking it up as much as possible and mixing it for pooled samples. Obviously, it doesn't apply to Fluke.
Okay. Then how do you know you need to treat for rumen fluke?
If you have clinical signs and the clinical signs are such that other causes of those clinical signs have been ruled out, and that would include other parasitic infections, PGE, for example, diarrhea, much more common cause of that kind of clinical sign in young animals, liver fluke as well, any other infectious disease, nutrition. So, you know, they are all much more likely to be involved than rumen fluke. So rumen fluke shouldn't be your go-to answer. It should be at the bottom of your differential diagnosis.
Okay. Which type of antibody tests are co-ops using around Ireland? A rapid decline or different?
To be honest, I'm not absolutely sure. I think there are probably a mixture of those. I know we have provided some recombinant antigen to some of those co-ops. And some of them may be using them, but I think there are probably more broad spectrum antibody tests in use as well. So I'm sorry, I can't provide you a definitive answer to that, but I will certainly investigate, and that's an important point to follow up on.
No problem. Is it a risk in reporting CD infections if considered relatively non-pathogenic?
I would say it's only a risk if the diagnosis is not accompanied by the appropriate information to say what this diagnosis means. And this applies to any parasitic diagnosis, any fecal examination. Knowing you have 200 Strongyl eggs per gram, for example, doesn't tell you anything until you know, in this context, in these animals, with these risk factors, this is important because, or it's not important because. So, you know, the diagnosis, reporting the diagnosis on its own without any accompanying information would certainly be not appropriate. But if the diagnosis is accompanied by the context and by education as to, you know, what this means in practice, then it's not a risk because information is always useful.
We've a couple more, but we've one for you, Grace. It's a UCD trial question on efficacy of actives for liver fluke. If the trial was conducted late in the season when livers are damaged by liver fluke in the sheep, the efficacy of TBZ will be impacted, thus leading to poor trial results, 51.8%. TBZ, when used early in season in sheep, when liver fluke is not damaged, will work well. Traditionally, farmers leave it until the dark evenings in November to dose sheep, flock, and the liver is damaged. Thus, other actives work better. Is the dosing habit and advice to change with certain actives in sheep?
Wow, yes, there's a lot of packed in there into that question. Okay, first of all, to say is that the aim in dosing sheep is not to wait till the situation that the liver is already damaged and now we're going to prevent any further damage. The aim should be to prevent the damage getting to such an extent that the metabolism of triclobendazole and therefore the efficacy of triclobendazole would be affected. When reports of triclobendazole resistance started coming out internationally, first of all, the story is, oh, you know, it's not really resistance because it's just been used in a sheep whose liver is so damaged that it can't metabolize and can't produce the active ingredient. I think we now know, and we now have very good evidence to say that triclobendazole resistance is widespread in many countries, including Ireland. So we can't say that it's just due to the fact that it's used in sheep with damaged livers. You know, if we are managing our sheep properly, if we're avoiding those dangerous areas, if we're using dosing strategically, we shouldn't be dosing or waiting till the liver is damaged and that way. I know that may be asking a lot, but really no, and that trial work wasn't mine, it was my colleagues in UCD, but I'm pretty sure that they would have taken those factors into consideration. And, you know, triclobendazole resistance is a real thing. Yeah.
Similarly, has the theory changed the pathogenicity of monasia in ruminants, reporting on the oversight?
I think Grace can maybe answer if there are any changes to pathogenicity of monasia. We reported an oversight because in young calves with very high numbers and they do have diarrhea, it may be due to the monasia, but on its own, it's generally pretty benign. But I don't know if there have been any changes, Grace.
Yeah, again, anecdotally, I think some people are saying, oh, you know, it can be a problem in lambs and so on. I think the standard story still is that it's not something to worry about at all. And I think in terms of the scale of parasite problems, it wouldn't rate highly in my book. I would say it's still not something that we need, you know, to be very concerned about. And if we're controlling, if we have good husbandry, good stocking density, et cetera, certainly we shouldn't be getting to the situation where monasia is a problem.
Last two, do large amounts of rumen fluke reduce the surface area of the rumen? Which is a
interesting question.
Yeah.
I think, again, a lot of the evidence is that the rumen flukes don't, and that they kind of burrow down between the papillae. But again, I think all of that work has yet to be done, and then we have to do the proper mechanistic studies to understand the relationship between those parasites and rumen function. So I mentioned methane production earlier, so there may be changes because the rumen relies largely on the other bugs, the other microbes, bacteria that are present in there as well, to produce the volatile fatty acids and so on. And there does seem to be an interaction between rumen fluke and the bacteria in the rumen. So an unsatisfactory answer, but ultimately we don't know yet.
Yeah. And last one, I'm going to cut it off after this because they're still coming in, so we can respond via email to the last couple of questions. But just for the last one for tonight, if you take a sample at housing and it is negative, are you recommending a second sample 10 to 12 weeks later?
Yes, because again, it may be that in the autumn time before housing, animals may have been infected with liver fluke, but may not, those flukes may not have started yet to produce eggs. So it's possible that they may be harboring them during the winter. So if you can, and if it's practical, it's a good thing to take a sample and assume that may be infection may be present. If you're in an area, again, where there is a high risk, if the forecast indicates that there's a high risk. So all of these things must be considered together.
I think this is just a kind of a general query, I suppose, on your take on the new regulations and things that have come in. But is remote prescribing of antihelminthics as proposed by the DAFM, is it a positive development in parasite control, or what do you?
Oh, so this is my favorite question of the whole night. So when I read that first, I read it to see, is prescribing of antihelminthics a positive development? And my answer there is unequivocally yes, absolutely. But when I read it again, and when you read it, Sarah, and I saw the word remote there, my enthusiasm was tempered a little bit. And unless I'm mistaken, we have to see the final format of this legislation as yet. But really what it comes down to is us as veterinarians and as SQPs and whoever else is involved in working together with farmers to get the best effects and the best parasite control for our animals. And we all need to work together to do that. I think vets for a long time have been guilty of maybe not being as involved in parasite control as they should be, and just wanting the easy answer, not really taking the trouble to understand the epidemiology. And, you know, you can't always provide an easy answer. And at the same time, I think as vets, we can't be precious about it, that we have to work with our end users, with our SQPs, with our licensed merchants, and we all need to work together, and all of us have a role in it. So let's see what the future brings.
Yeah, thank you both very much. As Craig mentioned at the start, it was our biggest numbers ever. We have 300 people signed up tonight, which is just phenomenal, and we've had massive live attendance. So thank you both for your patience and your time in answering all those questions. Just a little reminder for all of our guys to submit their AMTRA numbers and names to the CPD email, cpd@dugganvet.ie. And for now, good night and thank you both. And thank you for all of our attendees as well.
Thanks, everyone. It's been a pleasure. I really enjoyed it.
Bye.
Thank you very much. Thank you.
Bye-bye.